Welcome friends. Today we'll discuss about protein quantification. Before that, a quick recap about the color reaction with proteins. We discussed that the Ninhydrins test is a group test for amino acids which are used for detecting amino acid spots after chromatography. Biurets test was a group test for proteins, and this is used for quantification of protein in biological fluids like serum, ascitic fluid, etc. And this is what we're going to discuss today. The other specific tests of amino acids like the Sakaguchi's test, lead acetate test, cholesaldehyde test, xanthoprotein test, these are used for detecting various amino acids in the urine and hence diagnosing amino acid ureas. Now coming down to the Biurets test, the principle of the test is that in an alkaline pH, copper ions of copper sulfate react with two peptide bonds to form a violet colored compound. The intensity of the color is proportional to the concentration of protein, and this is read colorimetrically and compared to a standard treated similarly. The normal range of protein in serum is between 5 to 8 grams per deciliter. The conditions in which the serum proteins are raised is predominantly infection, where there is a polyclonal increase of gamma globulins, the immunoglobulins. Dehydration or loss of fluid from the intravascular compartment. In these, the fluid component is lost. The proteins, however, do not go to the extravascular space because the mass is very big. As a result, there is a relative increase in the concentration of proteins in the sample. Multiple myeloma, this is because of excessive production of immunoglobulin, which is monoclonal. In infection, we get polyclonal increase of gamma globulins. In multiple myeloma, we get a monoclonal increase in immunoglobulins. One of the common pre-analytical errors, that is, an error occurred because of faulty sample collection, includes prolonged tying of a tourniquet before getting the blood sample. Normally, we tie a tourniquet to make the veins prominent, and then we take the blood out. If the tourniquet is tied for a long time, because of increased hydrostatic pressure, more and more fluid is lost into the extravascular compartment, and the proteins which are present in the intravascular compartment artificially increase. Causes of raised serum protein include infection, dehydration, multiple myeloma. Low serum protein. All plasma proteins are produced by the liver except immunoglobulins. Hence, in severe liver disease or chronic liver disease, the serum protein levels become low, especially albumin. If the albumin is less than 3.2 grams per deciliter, it indicates chronic liver disease. The other causes include severe liver disease, nephrotic syndrome, and protein energy malnutrition, especially kwashiorkor. Other methods for estimating proteins include dye binding methods, electrophoresis done for subfractionation, and ammonium sulfate subfractionation can also be done.